yourself muted and to utilize the chat box if you need to. I want to take a quick moment and give a shout out to Walk Bike Nashville and their Tour de Nash community ride last weekend. I participated in the ride and I thought it was really well organized, and I hope that it was as successful as it could be given the limitations of COVID. So this is our agenda for today. We'll go through what happened since our last meeting, and then Carson Cooper from our research and analytics team will give a presentation on regional equity issues and trends. And then I'll demo an app that Ashley Reeves, also from our research team, put together for anything active transportation related. I think you all will definitely find that tool useful. And then we'll go through our next steps and member updates and get you all out of here around 1. Does anyone have any questions before I go ahead and start? All right. So last month, you all had a chance to see KCI and TDOT's presentation on their statewide plan, and then give feedback on issues that we would like to see addressed in the plan. And I'll let you all know that TDOT has begun their virtual open house for the plan, which I believe runs through October 7th. I'll include more information on that in a follow-up email. Then we talked about census accessibility data, and since the last meeting, staff has begun our unified plan project evaluation. And with that, I'll move on to equity. So over the past few months, we've been developing policy briefs on several topics, including roadway safety, congestion, environment, and now equity, as part of our long-range transportation plan update. So the purpose of this brief is to inform decision makers and stakeholders in the region of existing issues and trends related to equity in transportation, and to recommend strategies and actions that have to be taken to eliminate those inequities and provide better access to opportunity for the region's most vulnerable residents. Before we dive deeper into the data, these are some of the key issues related to equity in the region. At its base, people in the region need to have access to opportunity to be successful and to have a high quality of life, regardless of their race, ethnicity, age, wealth, gender, or ability. And more specifically, they need to have access to employment, education, healthcare, food, recreation, and transportation. And because of the development patterns and limited access to transit, walking, and biking, a lot of the region's residents, most vulnerable residents, experience inequities in relation to access to a high quality of life. And as the region grows, so does its cost of living, which disproportionately affects the region's most vulnerable populations. And in addition, the Civil Rights Act of 1964, along with executive orders and the Americans with Disabilities Act, require that we identify, address, and provide access to communities that have been historically and continue to be underserved. And lastly, as you will hopefully notice, the COVID-19 pandemic has exacerbated and exposed many of these inequities that our region experiences. So with that, I'll hand it over to Carson.
Hi everyone, this is Carson Cooper, presented to you all before. I'm on the research team under Max Baker, and I'm just going to show you the equity analysis we do for the project evaluation process of the RTP. Also, can everyone hear me okay? I can speak up if need be, so these are the 9 vulnerable populations that we identified as vulnerable. It's based on Title IX and environmental justice federal requirements, as well as some additional populations that we've seen as vulnerable to changes in the region, not just development-wise or from environmental impacts, but also cost of living and other sorts of barriers to access and kind of being traditionally or historically underserved. So these are the 9. It's minorities, both racially and ethnically, low-income populations, specifically poverty or those that are unemployed. Limited English-speaking households have a lot of barriers to accessing information. the disabled population, and we've talked about ADA accessibility previously, the senior population as well, single mother households, which we have talked about internally, possibly transforming to single parent households, but it's kind of getting at gender as a protected class and single income household limitations. And of course, carless households have poor access to the whole system of transportation. But on the next slide, this shows how our populations kind of measure up to those other federal requirements or considerations that I mentioned, such as ADA, Title IX, or Title VI, sorry, and environmental justice. So we're addressing many more populations comprehensively than a lot of federal perspectives. And on the next slide, you can see how our region breaks down as a whole on the average of each of these populations. So 12% of the entire population are seniors, while 3% of all of the households in the region are limited English speaking. This is kind of our baseline for comparing how certain areas measure up compared to the regional average. And as I get in more to the methodology behind identifying vulnerable areas, we can compare back to these. And the next slide just shows how these populations have changed over time. So pretty much all of them have increased, and a lot of them have increased faster than the total population has increased. For example, the total population increased by about 16% in this same time period, while ethnic minorities, racial minorities, and seniors all outpace that growth. So more people are moving here in general, but specifically more senior people, more minority people. And it's interesting to see too how, so in unemployment, we want a bigger decrease in that because 2010 was just after the recession. So it has gone down by almost a third across the region. So I just wanted to point out why that one was negative. So the next slide kind of breaks down how we're defining or using terminology to talk about this index. So the degrees of vulnerability are how we created an index scoring mechanism of these 9 vulnerable populations. And a vulnerable area is an area where that vulnerable population, and this area is measured at the block group level, is above the regional average. So that first graph I showed you, about 12% of the population of seniors. So if a smaller block group area is higher than that, it would be considered vulnerable for seniors. And then so each one of those populations is evaluated individually to create a score of 0 to 9. And highly vulnerable areas were areas that we identified where the score was at least 6 or more of any of those populations. So on the next slide, we're going to go through a series of maps behind identifying these populations. So again, it's comparing the block group to the entire region of the 7 counties, but it's specifically comparing the proportion of the population to the proportion across the average. So it's not always going to measure up with how many people live there, but it's how many out of the total in that area. So as you can see here, there's more seniors in Davidson County and downtown because there's just more people downtown. But a lot of these orange areas highlight where they make up a proportional higher population, or more than 12%. So just keep that in mind. And these maps really help show that discrepancy between density and proportion. But with seniors in particular, because people age all across the region, it's very dispersed throughout the region, but some of our other populations will be more concentrated in certain areas. And then we've highlighted in the kind of left-hand figure, just that how many of the whole region are represented in these orange areas. So 12% of the whole region's population is seniors, but 66% of those seniors live in these orange areas. And I'll go through the next few a little bit quicker so I don't have to explain so much of the methodology. But on the next one, racial minorities or the non-white population, definitely more concentrated in those urban areas. It does kind of align more with density. A lot of these are more historically non-white communities. and about 3/4 of the entire minority population is represented in these concentrations. Similarly, with the Hispanic and Latino population or ethnic minority, very much more concentrated in certain areas and more aligning with density, also kind of dispersed throughout the region, and again, representing about 3/4 of the whole region's ethnic minority population. The following slide shows that the disabled population, similar to seniors, because people age in place, they can become disabled in their older age. It's more dispersed throughout the region and not really concentrated in any sort of pattern, and is again very much represented by these orange areas. On the next slide, single mother households are also pretty dispersed throughout the region. And like I said, we evaluate this population because it's single income, it's more difficult to care for children, they're more vulnerable to cost of living increases, perhaps more vulnerable to traffic or transportation barriers. But we have talked internally about increasing this to separating females and then single parents as kind of a way to look at both of those more closely instead of such a niche group of single mothers. On the next slide, carless households. I found this pattern pretty interesting, that a lot of the orange areas are actually in areas kind of far from urban areas, in more rural areas. So they definitely have an access issue. And while carless households don't make up a large percentage of the entire region, it's definitely a demographic that we want to target and provide the most resources we can to through public transportation, or of course through walkable infrastructure. Limited English households definitely follows more of a concentrated pattern and very similar to the ethnic and racial minority patterns, because those communities may be immigrants or first generation and therefore may have limited English. And much more of all of the limited English households are represented in these concentrations, almost like 90%. The next slide shows the unemployed population, very much more dispersed. But it is interesting to note that once we get later in the slides, we'll see where the jobs are. So it's interesting that the unemployment is so widespread across the region, while the jobs are so concentrated in certain parts. And finally, families in poverty, also kind of dispersed throughout the region, with an exception of Williamson County. There's a little pocket there around Franklin, but not much poverty going on in Williamson. And again, it's just looking at the proportions instead of the density. So after looking at all of those maps, think of this as kind of a composite of each one of those orange areas, with 9 being the highest, meaning that all 9 variables were orange or higher than the regional average. So definitely some concentrations in more of the urban areas, kind of less vulnerable in Williamson County, but they have a much higher income, median income there. And then we identified of that score 0 to 9, the highly vulnerable areas that scored 6 or higher. So 20% of the region's block groups scored 6 or higher, which is a pretty significant portion of all of the block group areas that we looked at. And then we decided to kind of cluster them into their geographies based on the local jurisdiction around there, or when it came to Davidson County, the neighborhood. So on the next slide, you can see how they were labeled. And if you see your community, you can see that it pretty much does align with city boundaries. With the exception of Davidson, we kind of split it up by neighborhood because Davidson's a little unique. But this next table is really just for reference. I'm not going to go through it, but it shows a profile of the specific highly vulnerable populations that each of those cluster groups had a high concentration of. So some of them scored all the way up to 9, meaning all 9 were represented as a highly concentrated population. Some of them scored 6. So later on, you can reference like which ones out of the 9 were represented. And then looking at how this compares again to those regional averages, the whole point of this analysis is to look at where these areas are more concentrated. So this is those cluster areas, the percent of these populations. Obviously, all of them are higher than the regional average, meaning they're disproportionately higher, except with the exception of seniors, but that's again because seniors are a little more dispersed. So of those 9 variables in each of those clusters scoring 6 or higher, seniors was one that didn't come up as much, but all of the other ones definitely were. And then the next one is really interesting. We can compare the change that occurred in each of these highly vulnerable areas versus the region's change. And so the region is higher for these bar changers, the blue bars, because the raw numbers are just higher. We had a bigger increase in population, so we had a bigger increase in seniors. So the region as a whole grew more than these smaller representative areas. But it's important to note that it is increasing for both the region and these vulnerable areas. But what's interesting to note are the light orange boxes that I've highlighted. So it shows the representative change occurring in each of the highly vulnerable areas. So while the region as a whole increased in the non-white population by 21%, a third of that 21% occurred in these areas. Some other dramatic figures are that 40% of the increase in limited English households occurred in these concentrated areas. So when we're looking at these areas, they're disproportionately vulnerable, and they're becoming that way over time, and they may and likely will do that looking into the future out to 2045. So it's another interesting note, again, the decrease in unemployment, we want to see a larger decrease. So while the whole region saw a reduction by 27%, these highly vulnerable areas are still kind of suffering from that recession and having less of a decrease in unemployment. So now we're going to talk a little bit about how these vulnerable populations have access to employment and transportation, and how we can better kind of serve them, and looking at active infrastructure, cars, everything. So this next map shows access to jobs, and this is sourced from the Longitudinal Employment Housing Dynamics database. So it's showing where people that live in the gray highlighted areas work. So obviously it's much more dense around downtown. Those yellow areas are where most people are working that live in these areas. So a lot of them are commuting pretty far, and only 9% of the whole region's jobs are held by these residents, which is pretty representative of their population. And people are, commuting as far as areas as Mount Pleasant. So, but while the HBAs represent 17% of the population, they only hold 9% of the jobs in this region. So they could be also commuting outside of the MPO, maybe even having farther commutes, or commuting to places like Clarksville that aren't represented in the MPO. And then on the next map, we just tried to add transit stops and see if these jobs are maybe accessible by transit. And so they are relatively accessible in the urban areas, in the urban core where the jobs are, but they likely aren't for many of these satellite communities where they would be commuting from. This is no new news in Nashville. And it's also important to note that while these are within a half mile of a transit stop, that doesn't mean that the route is necessarily servicing them or that it's accessible, but it's just another way of looking at it. Similarly, we also wanted to dig a bit further into commute times and patterns. So this shows the roadway travel time bands of the PM commute across the region for transit. So it dramatically decreases the area that people are able to travel with the average commute time of 30 minutes across the region. So you can see all the way out to some of these areas where their commute time, if they wanted to use transit, maybe upwards of 2 hours. The travel time band does include headways, but it does not include transfers. So it could include the amount of time you're waiting for the bus, but it won't include if you're taking multiple buses, which is pretty important to note. And of course, there's some areas that are just not accessible by transit at all, whether it's by bus or by the Music City Star. So really just our urban core of downtown Nashville is benefiting from our transit service currently. Now we're going to get into some more BPAC relevant things, but we wanted to look at the actual density of infrastructure for active transportation. Many of the HVAs actually have a relatively high transit stop density. And again, it's very much more concentrated in those urban core areas. Obviously, there's some that aren't serviced by transit at all, but definitely in closer Davidson County, we have some good service stop density wise. Similarly, we have a trend for sidewalks, bike lanes, and greenways and trails. Interestingly, Franklin and Murfreesboro and Gallatin kind of bump up into that top tier of having a lot of miles of these infrastructures per square mile of area. And then this kind of summarizes who was coming out on top. So it gets, again, those closer urban core areas that I've highlighted on this table that show 440 East Nashville and North Nashville had the highest densities across most of the categories. So it's cool to see that we're actually serving these areas pretty well with density of transit and walkable infrastructure, and that there may be just an indication that the routes or the service reliability, frequency, cost, it points out that there's other things going on that may be limiting access rather than just the density of the infrastructure itself. It's there, but we just need to improve it, which we all know, definitely around safety of walkable or bikeable infrastructure. Even if it's there, that doesn't mean it's really helping anyone. So then we did this same analysis of density of infrastructure, not just looking at those 6+ highly vulnerable areas, but looking at highly vulnerable by population versus not highly vulnerable by population. So above average being vulnerable, we're actually serving the navy bars of each population much better with regards to transit stop density, with the exception of seniors and disabled, which I actually thought was pretty interesting because they're two populations that we would really want to service well with transit. And I will say this doesn't include paratransit. Obviously, these are only fixed routes, fixed stops, but it's just something to consider when looking at this. And then on the next slide, we see the same trend for sidewalks, bike lanes, and trails. But again, it's seniors and disabled that are kind of coming out short. And it is partially because they are two populations that are more dispersed around the region, but it's also two populations that we're more concerned with when personally I am when it comes to walkable, bikeable infrastructure. Especially there's some accessibility issues related with both of those populations. So it's not just about the density of the trail or sidewalk infrastructure, but the quality. So it's just something to consider as a part of this whole analysis. So then we looked at transit route distribution and not just stop distribution. And we highlighted high frequency routes, which we defined as having 3 to 4 buses per hour or having a 15 to 20 minute headway, or the amount of time that you wait for the bus. Across the region, including the express routes and everything far reaching, the average headway is about 42 minutes that you would have to wait for the next bus, which is pretty long, but it's really crucial that services are on schedule, or it could affect someone's trip by upwards of an hour, especially in these further reaching areas. And I know the express services can be typically more on time because they do have that headway to deal with, but even our high frequency routes, as a previous bus commuter pre-COVID, my route was pretty variable and I was in one of the urban core routes. So just something to consider. And then we started looking at how some of these trip variables possibly correlate with each other. So here the vertical axis is percent of households without cars, and the horizontal axis is percent of workers with a commute under 30 minutes, which we defined as kind of a shorter commute. We use the MPO averages as a threshold with that orange dot to see where the rest of the highly vulnerable areas scored. And it's interesting to see that most of them are above average for both variables. So they have higher concentrations of carlessness, but also have more people with shorter commutes. But that short commute could be out of necessity, that you have to walk to work because you don't have a car, but then you're not really reaching those higher paying or more desirable jobs downtown or in another city that you may not be able to get to. So it's not to say that the transit or other mode they use to work has a short commute, but that it gives an indication that the commute is out of necessity and they're just limited to closer proximity jobs. So a lot of people in the MPO have this short commute of 30 minutes, like the majority of workers. So it's really, we're concerned about the more rural counties, surrounding counties of Davidson. And on the next slide, again, out of that necessity, this shows that the average lowest headway for each highly vulnerable area in comparison, again, to carless households. So again, very interesting that all of these areas are above average for the amount of time that they wait for a bus, but also being the ones in most need of transit because they don't have a car in their household. And the previous slide for commute time doesn't include the headway, so that's why we wanted to look at this slide. And it just included the bus trip time. So even if they had that short commute, if they fell under average in 30 minutes, that may not include the amount of time they're waiting for the bus, which could be upwards of 40 minutes. So their average commute could be upwards of an hour and a half, including the headway. And if they miss that bus, there's definitely no way of getting to work on time. So I find these correlations or scatter plots really interesting. I hope you do too. And then to kind of holistically look again at this analysis, we wanted to look at housing and transportation costs. Housing's definitely more, market variable, but all of these areas are disproportionately paying more of their income than the NPO average, which is 44%. But it's interesting that it's not just dependent on geography, because you see areas really close to the urban core, like North Nashville, that are paying upwards of 80% of their income just to live. So it really is an economic indicator of how much they can contribute to the economy, how many jobs that they're really getting that are more desirable downtown or maybe more higher paying. It's sad to see, honestly, because they're paying so much of their income just to live. And it's not to say that they are paying more dollars on transportation, but just that they have such a low income and low access to better opportunities to, upward mobility, that they can't really afford to, do that. But the next slide shows the dollar amounts broken down. So again, like the dollar amount of these areas may not be that high, but proportionally to their income, it becomes a lot, or it becomes a burden. With the exception of looking at Williamson County, the gap between their income, which is that blue dot, and how much they're spending just to live, not including, fun stuff and groceries and everything, just on housing and transportation, is much bigger gap than a lot of our highly vulnerable areas or even some of the other counties. So just showing kind of a wealth and cost proportional gap. And then also looking at safety. So this was a really interesting analysis that Ashley Reeves did. So you can just look at total crashes across the region. We've seen this map before, and how the HVAs kind of measure up against that. No surprise, the crashes are along major corridors, choke points, urban core areas. We've seen this. Same thing on the next slide with the non-motorized crashes, which is really interesting because a lot of these vulnerable populations are probably non-motorized users if they don't have a car. But the really interesting and kind of home hitter on this is the next slide, which shows that these areas are disproportionately representing these crashes. So by population or by area, they far outnumber non-motorized trucks, fatalities, and serious injuries, and all crashes. So the population is only 17% of the whole region. The area is only 6% square mileage wise, but non-motorized crashes specifically is 30% of all non-motorized crashes. So they're definitely concentrated in these areas. And it's something that we really need to address with more Vision Zero policies, complete streets policies, and the work that BPAC does and focuses on. So that was a lot of data to digest. Happy to answer any questions, but I'm going to turn it back over to Daniel.
Thanks, Carson. Well, before we get into questions, these are just some highlights from our key findings. First, the region's population, as Carson noted, is growing, aging, and diversifying. So knowing this, we have to make sure that we're providing mobility for those who need it most, and ensuring that it doesn't put a burden on the highly vulnerable areas that Carson described, so that we do our best to avoid things like displacement and gentrification. We also found that while transit, walking, and biking infrastructure exists in many more places than it previously did, it is unreliable and unsafe due to infrequent service and lack of connectivity. And that brings us to some necessary actions and strategies. First, we need to prioritize equity in all decision making so that our investments reflect that. The data that we have can inform this decision making, but we have to make a point to incorporate equity into everything that we do. The region is in desperate need for transit improvements and expansion. And as everyone in BPAC well knows, we have to be more intentional with our complete streets policies and design so that everyone can walk and bike safely. Most of our local members don't have complete streets policies, which we definitely need to do a better job of implementing. And then finally, we need to improve public engagement so that our most vulnerable communities have a seat at the table, and that what we do reflects the needs of every community in the region. And this will take coordination from state, regional, and local levels so that we can provide the best possible quality of life for everyone in the region. And then finally, you can always go to our data dashboards and explore trends on our website. I want to take a moment and give a shout out to Max, Carson, and Ashley, and the rest of our data team. Without them, none of these briefs or data analysis would be possible. So thank you all for the awesome data analysis you guys have done over the past couple months. Does anyone have any questions before we move on to our next agenda item?
This is Bob Murphy. First of all, I want to say that was a very impressive presentation with a lot of great information. And can you make the slides available to us? I'd like to have some time to spend more time looking over that. I just thought it was really interesting.
Thanks. Yeah, absolutely. I will send the slides as a PDF and a follow-up email.
Yeah, I would agree with being able to look at that that data. It's Bill McCord over in Gallatin. I was kind of curious about the report of that 32% of households in Mount Juliet have no vehicle available, or 31 or 32. Yeah, I don't know if I saw that right or not, but that seemed to pop out. It seemed unusual. But I'd like to look at those charts as well.
Thanks, Bill. Anyone else have anything to add?
Yeah, I understand the purpose of the way the data is pulled together, but oftentimes a lot of people are they're double counted. They may fall into 2 or 3 of these categories. One person or one household may fall into 2 or 3 or more of these categories, and it may tilt the data more in favor of looking that investments should only occur in these HAVs. I would be interested to know about the percentage of roadways. We saw some stuff on transit, but the percentage of roadways and other facilities that are available in these HAV areas that were identified. So as opposed to the all over the MPO area or non-HAV areas. I don't know if that data is available or not, but.
I will say the 30% isn't like the city of Mount Juliet. It's just those block groups that we identified as being highly vulnerable. So it's not all of Mount Juliet. It just was concentrated near Mount Juliet.
Right.
And I definitely agree, this isn't like a perfect indicator because a lot of seniors are also disabled, or people living in poverty may also be unemployed and single mothers. So there is some overlap here, but it's trying to just identify, if they are being double or triple counted, that they're very vulnerable, even if it's just one household or a few households. So
Yeah.
there are definitely better indicators out there, and we're looking at other ones. This is very, high level because it's for the region and regional transportation plan. But I actually have a call next week about more of an economic indicator that was developed based on vulnerabilities of COVID and like service industries and who was probably most impacted by that. So there's definitely better tools out there, and we'll definitely keep sharing them. And I would also really like to take this time to ask the BPAC their specific feedback on the active transportation analysis, because the best that I could do right now is, infrastructure density. But if there's any kind of indicators you all know of, or if you have just any, professional feedback on like, yes, I think this aligns with those highly vulnerable areas, I would love to hear it.
So this is Rochelle, and I mentioned this before, but I think we need to take into account project design. And so, I've shared this example previously, but if we have a bike lane on a project that's a road widening, it could get just as many points under the equity analysis as a complete streets project, for example. So I think we need to do a better job of weighing projects that are better for bicycle pedestrian infrastructure than we are now.
I will say I am the one identifying or evaluating projects for this whole metric that I just showed you. And while I just showed you all this data that goes into this metric, it's only one of the questions. So I just identify if it's highly vulnerable based on that, base level score. But even if it's not, I still look at each of the questions and the project's design to try and really best suit the populations that live there, even if they're not high scoring. I've started evaluating projects, and I've looked at it like, I just did a road widening and they were adding a sidewalk, which I was like, that's a good start, but it's not really serving the 6 vulnerable populations that live there, including carless households where they really need that sidewalk. Or if you're adding the sidewalk, are you adding also crosswalks with stops because people are going to jaywalk or things like that? So I really am looking at each project's design. I'm looking at Google Street View. So I just want to assure you that that's that qualitative part that we all are taking into account. So this quantitative part is only one of the questions, but I have 4 other questions to really get at the project design, as well as the community engagement efforts that should accompany the project. But I'm also really, I encourage you all to give me more feedback on that.
Yeah, and I appreciate that. I was the one who did the equity analysis, the qualitative and equity analysis for the MPO 5 years ago when we developed that last plan. So I know well how the process works. But I still think that, there's a lot more that can be done to ensure projects are being weighed more that actually improve the conditions for walking and biking.
I 100% agree.
And Rochelle, I'll second that. I'm doing the active transportation staff analysis, and Carson and I have been talking a lot about how we're not going to be ranking projects higher that are road widenings than solely multimodal projects. And we haven't been through all the projects, but I definitely have been paying close attention to making sure that even if it is a road widening, something like a multi-use path is more considered than anything that would not improve safety for active transportation users.
Thanks. And I'll just say also to Bill's point that I hear what you're saying, but I wouldn't think of it in terms of double counting or triple counting. I think Carson said this too, but it's if somebody has, or if a household has 3 of those indicators, a higher than average rate of 3 of those indicators, then they are, they're vulnerable 3 times over. So I wouldn't personally consider that double counting or triple counting or what have you. It's just another indicator of their increased vulnerability.
That's a good point, Rochelle. Thank you. Oh, Bill, go ahead.
This is Bill McCord. Is there any direct indicator that measures health or poor health in relation to availability of transportation facilities? Or could we assume that maybe some of these categories that we've already identified as vulnerability are replicating health, quality of health?
I'm looking at access to health clinics as well as community organizations because, I mean, mental health is a concern as well, or just kind of like a resource as access and stuff. But qualitatively, looking at locations of health clinics, proximity, is the project aligning or creating any more access to health clinics for that area? And then also looking at air quality. So if it's a road widening and these are, vulnerable populations they're classified under environmental justice, which the EPA, their EJ screen tool is mainly based on air quality. So if the project has poor implications on air quality, I score it low for equity. And I also look at the current air quality and like how the development is going to change. Growth is going to happen. Air quality might going to get worse because growth is happening. But if the project can do anything to mitigate that by encouraging active transportation, those are kind of the ways I'm addressing health. There's a limited amount of data at this fine of a level when it comes to health data. The only data available through the census at the block level or block group level is life expectancy, and kind of like who has access to healthcare based on what kind of insurance they have or if they have insurance, which isn't the best indicator when it comes to access. So that is something that we really need to improve on. Not only our analysis, but the data sources that we're drawing from. So I agree that health is kind of a gap right now, but it's something that we're just kind of amping up qualitatively.
Okay.
Hi, Bill. This is John Vick with the Tennessee Department of Health. I want to jump in really quickly. So we've been working on creating a health risk index using hospital discharge data. So we've been working with Max at GNRC on this, and we're pulling the data right now for it. But that's a little bit better indicator of health. So our hospital discharge data system at the state level is actually a data set of all of the hospitalizations that happen across the state, and we can actually look at different hospitalizations for different diseases, and we can get it down to the zip code level. So we've been working on that, and we're looking at hospitalizations for heart disease, respiratory illness, diabetes, obesity, different types of diseases that are related to physical activity and active transportation. So we're working on that. Hopefully we'll have it prepared and ready here in the next few weeks. But that's an example of a new data source that we can use to look at hospitalizations for different health outcomes at a smaller geography.
All right. Does anyone else have anything else to add?
Hi.
Oh, go for it.
Sorry, this is Teresa Anderson from the Housing Development Agency. And I just wanted to add a helpful source of data that we had at actually a previous job. I had an MPO in a different state when we were working with the transit system to develop a plan for their development. We actually looked at the paratransit. I'm not sure if this data is available or how it's kept, but we looked at paratransit where they picked up and dropped off those locations and mapped those out, and that helped with not only disability, finding out where people were going who needed and were unable to get to transit or use their own car or things like that. But it also most of those locations that they were going were the doctor's offices and hospitals, which kind of helped with that aspect of health access as well. So that's just for consideration.
Thank you, Teresa. That was really helpful. We'll be sure to look into that going forward.
Yeah, this is Max. I think, is Justin on the line? Would he be the appropriate contact? Oh, his microphone's not working. I don't know what he's saying. Let's see. Okay, I'll follow up with him on that. But it's through WeGo, Teresa?
So the data I'm talking about was in a different state. But if but if we were to look at that here, yeah, I would suggest WeGo if they keep that sort of like coordinate points for drop-offs and pickups.
Okay, thank you.
Mm-hmm.
And hey, Max, I am here. Sorry. What was your question?
I was wondering if Justin was the right point of contact to get that. Yes. Okay. He says yes.
All right. Thanks, everyone. I'm going to go ahead and move on to demoing the Active Transportation app. So let me just switch screens real quick. All right, can everyone see my screen?
Yep.
Okay, perfect. So this is an app Ashley Rees from our data team put together for active transportation analysis. We took a lot of the same data layers that we used in the priority areas, but we split it up into tabs, as you can see here. This time to streamline it and to make it a little easier to use. So the tabs are user activity, safety, population health, education, and then finally the BPAC priority areas. So as you can see here, in every tab there are existing infrastructure layers, greenways and trails, sidewalks, bike lanes and routes, transit stops and transit routes. So you can turn any of these layers on and off. I won't spend too much time on this, as I want to let you all try it out on your own, but I'll just give an example real quick. So if you turn on, let's say we're looking at pedestrian connectivity and safety. You can turn on the pedestrian BPAC priority area along with the, let's go with sidewalks. I'll let it load real quick. So we talked a lot about how some of our most unsafe roadways are state routes. So I'll take Nolensville Road, for example. So you can click on here to see each tier of the BPAC ranking. So the darker ones are top tier and the lighter ones are bottom tier. So we can look here and say, okay, we know that Nolensville Road is one of our most dangerous roadways. Here are some gaps in sidewalks. Almost the entire thing is within the top tier of BPAC rankings. So that's where that would tie in. And you can see that even in some places where there is sidewalk connectivity, it's still in the top tier of the BPAC ranking. And so then we can go to safety, for example, and look at the same area. Wait a second to load. And we can turn on sidewalks again, and then turn on fatal pedestrian crashes. Zoom in. And then let's take this area, for example. On the intersection of Nolensville and Harding, we can see that there are lots of pedestrian fatalities. And can't really assume, but for purposes of this meeting, we can say, okay, there's probably some access management issues here. Lots of pedestrians dying near this shopping center and place where a lot of people frequent. And then maybe this one is cause of an unsafe intersection, and then you can click on each fatality and see details from the crash report, what the weather was like. And you can click on each one. I think there's one in here that has, that was during when it was raining. But each, yeah, there it is. So you can turn on any of these. You can turn on fatal cyclist crashes, and then serious injury pedestrian crashes, serious injury cyclist crashes. And then each other tab has data layers that you can turn on, along with all the sidewalks, greenways, and bike lanes. So I'll include this, the link to this app in a follow-up email, so you guys can play around with it. But does anyone have any immediate reactions to the application?
Daniel, can you also show them that you can change the base layer too if you want to see the imagery layer too?
Yeah. I'm not exactly sure where that is. Sean, can you point in the right direction?
Just in the top bar of the layer grid, press the grid over to the right.
The 4 squares.
Oh, right. Any of these?
Just imagery hybrid. It's like the 5th one down on the left.
And then you can see a little clearer. Thanks for pointing that out, Sean. Anyone have any comments on the app?
Bill McCord over in Gallatin. Is this for GNRC area wide, or is it just Nashville, Davidson County?
It's for the entire MPO region. I'll zoom out real quick so you guys can see that.
Okay. So the sidewalk data, bikeways, sidewalks, greenways are available on all of these?
Yes.
Okay.
So they'll be right here.
Yeah.
On the layer list.
Hey, Bill, I'll add to that. This information comes from a mashup per se of TRIMS information, local GIS departments across the region, plans, any data source that we've been able to access. So if you play around with this and find any issues, since the data QA/QC is not always the best on especially sidewalk and greenway information, please reach out to us and let us know, and we can make changes. It's hard for us to get eyes on the ground across 7 counties and verify this. So if you guys know more about the local areas, we appreciate any suggestions.
Okay.
Thanks, Max. So does anyone else have anything before I move ahead to closing the meeting out? All right, I'll pull up the PowerPoint. So these are some potential future topics. We're going to continue with our staff project evaluation. And if we come across any projects that we think we need BPAC's feedback on, we might bring those to you. And then hopefully we can get an update on the transportation plan. I don't know how many of you saw. They gave us a little teaser on their transportation plan last week. So in the future, hopefully we'll hear some more about that. And then, Marty, I know you have an update on the Granny White bike lanes, but in addition to what he's going to say, if anyone else has any updates, feel free.
Yeah, good afternoon, everybody. I hope you're doing well. This is Marty from Bike Walk Brentwood. A little update on the bike lanes along Granny White Pike. So a little quick background on that is it was something that kind of dates back to the 2016 Brentwood Bicycle and Pedestrian Ad Hoc Committee recommended it, as Granny White Pike was a fairly wide road with wide bike lane or wide vehicle lanes and a center turn lane. And so in 2020, earlier this year, the commissioners were presented with 3 different options from an engineering firm that they contracted to conduct a traffic study for the upcoming repaving. The options only included street striping. There was no widening or structural changes being done to the road. And they were given 3 options. 1 was keeping the road as it was. 2 was adding non-buffered bike lanes and keeping the center turn lane. And the 3rd one was to add buffered bike lanes and losing the center turn lane. The center turn lane was really hardly ever used, as there's only a few houses on the side of Granny White Pike. And the traffic study that was done confirmed that the center turn lane wasn't justified. So we, as the Bike Walk Brentwood committee, recommended and advocated for adding buffered bike lanes and losing the center turn lane. The commissioners ultimately voted to add non-buffered bike lanes and to keep the center turn lane, with only 1 commissioner voting against bike lanes in any form. And while the Granny White Pike was repaved, and everything is painted now. But how they have it lined up is there's a 6 inches narrower on both sides in the bike lanes than we were supposed to have, which resulted in 12 inches total loss in bike lane width. I've ridden it a number of times, and it doesn't look or feel quite like a regular bike lane. When I ride in the center of the paved portion of the bike lane on a mountain bike, my left hand on the handlebar is on top of the white line separating the bike lane from the car lane. That said, it does connect some really good things there: schools, parks, a couple of neighborhoods, and people seem to be pretty excited about the addition to bike lanes on Granny White Pike. They also added some crosswalks and repaved areas. And I noticed that there was on the recommended future topics was something that we've been talking about in our area, was looking at local infrastructure plans, especially on a multimodal level. And I was looking around at some of our surrounding communities like Franklin and Nolansville, and they have a very nice master plan of where they're going and what their plan is. Brentwood, we don't really have anything like that. We seem to operate very differently here. We seem to get stuff like this, but it's something that's like at each part, you have to kind of go and fight for it. And at this point, that bike lane doesn't actually really connect to other multimodal infrastructure. It's kind of exists a little bit in its vacuum. And at some point, it would make sense to connect it in ways that make sense when you look at it and you look at the map, but we have no master plan that says like, yes, we're planning on doing this. And so that'd be something that'd be really great to see change. I know that's kind of a local thing, but yeah, that's about it I have.
So this is Bob Murphy. I just had a comment. I would say to Marty, thanks for that explanation. I had seen the bike lane, and the thing that struck me was that it was narrower than it needed to be, and that the remaining lanes were wider than they needed to be. So I guess that explains what that's about. But I definitely think having the bike lane is better than not having it. So it's unfortunate it happened that way, but I think it's a positive to have the bike lane.
Yeah, definitely.
Thanks for that comment, Bob. I think that's pretty on point. Does anyone else have any updates they'd like to share?
This is Bill McCord over in Gallatin. Our engineering department received bids for Safe Routes to School project in close proximity to Rucker Stewart Middle School. It will also include a crosswalk and a sidewalk extension across Highway 109, which is essentially a barrier around the west side of Gallatin for pedestrians. So it will provide and open the door, if you will, to providing a safer pedestrian crossing from east to west side of Gallatin. So we're hoping that will be able to get started here before too long. And another thing, I don't know if we have a representative from Sumner County as a whole. The Sumner County Commission has authorized that a county-wide recreation plan, and they've hired a consultant who is working on that project right now, is gathering data. I'm sure the MPO staff is involved in that. It will involve not just recreation facilities, but also certain active transportation facilities too. So we're excited about having that underway, and that will provide us additional opportunities for coordinated efforts to provide for priority active transportation facilities.
Bill, thanks for mentioning that. I think we'd GNRC, speaking for GNRC, I think we'd love to get plugged in, and I think a lot of the work that we've done through the that Daniel just showcased can help get that process started. So just plug us into the appropriate contacts, and we can make sure that we're sharing all the relevant data for that planning activity.
Okay.
Thanks, Bill, and thanks, Sean. I'll be interested to see how that develops. Does anyone else have anything to add before we close out? All right, well, thank you to everyone who attended today. I'll follow up with information on the statewide plan, and as well as the link to the app that I demoed and slides from today's presentation. Thanks, everybody.
Thank you.
Thanks.